Yeah, we are encouraged, aren't we, to have more kids. I'm past the having kids age, but governments always want more children because they need the taxpayers, they need to increase the population, and some people, of course, disagree with the whole theory of increasing the population. They say we've got enough now. So then migration comes into play and refugees come into play, and we discuss all of that. So then it comes down to sometimes the cost. And a lot of people say, well, it's all very well for the government to say, well, it'd be nice to have more kids in Australia because we're at zero population growth amongst Australians. That's why we are importing people from overseas. So we're not reproducing ourselves, replicating ourselves, if you like. So the cost of having kids. What about $26,000 in the child's first year? Would that encourage you to have more children? Well, my guest is Sharon Goldfeld, Director of the Centre of Community Health at Royal Children's Hospital and a Professor in the Department of Paediatrics at the University of Melbourne, joining me on the line now. Good day and thanks for your time.
Thanks very much.
The cost of having kids, I think if you thought about it, it'd frighten you, wouldn't you, through how long they're going to be with you. It could be until their late teens or their early 30s, yeah.
Exactly, and I think there's been lots of work looking at the cost of having children, and of course that cost isn't felt equally across society. There are parts of our society that feel that cost much more.
Yeah, indeed. So the whole idea of, if you like, a lump sum, one-off payment of $26,000?
That's right. So it's probably worth backtracking just a little bit and sort of wondering why we're even interested in this. Yeah. And so I think it's just important to just think about where we are as a society. I've just noticed in the listening into what you were talking about, there's kind of real conversations, isn't there, about kind of what sort of society do we want to have for Australia. And one of the real issues that we've got is kind of by the time children start school, if we look at their kind of development, using something called the Australian Early Development Census, there's kind of 3 times the difference of children being developmentally vulnerable in the lower income areas of Australia compared to the higher income areas. So we've kind of got this issue about if we're going to make a difference for Australian kids, we better get going when they're early, at a time when we really can make a difference. So one of the questions on the table, when we talk about this idea, the social determinants, the things that might actually make a difference, is what would happen if you gave people more money. We talk about a lot of things. We talk about services, et cetera, but what about if we just gave people more money? And, for example, that's what we did during COVID.
Yeah. Yeah, it's interesting, isn't it? Because, yes, you can give all sorts of benefits and rebates and tax concessions and it's all a bit piecemeal. But if you just give this sum of money, look, I'm looking at a figure of $26,000. So how did we arrive at that?
So that's kind of more or less what we gave during COVID for JobKeeper. So we sort of thought, you know what, we did it once. We showed what's possible. What about if we gave it again, but actually modelled it to say if we gave families this money at a time when it's most likely to have an impact on children's development, what would happen to the inequities in kids' development when they're older? And this is modelling, I might add, but it's a really kind of cool thing to do.
Yeah, it is a cool thing to do, which is what attracted us to the idea. Tell us about the Changing Children's Chances projects and what we're trying to do there.
Well, Changing Children's Chances is really all about what it says, which is how can we use existing data that we have to model, so use fancy statistics, in other words, to model what we call causal relationships. So we do a lot of data and we say there's an association between X and Y, but what we're trying to do is use data to show is there an actual relationship that X causes Y.
Right.
And that's very different because it's really helpful for policymakers to know, well, association is one thing, but hey, if that causes the other thing, that's much more interesting from a policy point of view. So we're trying to use data and statistics, but underneath all of that, we're also trying to say, what is the kind of stack of things that families might need that's likely to make a difference to children, of which money is one of them?
Yes, and obviously that's going to make a tremendous difference to low-income families.
Well, this is the exciting thing and the interesting thing. So it will definitely make a difference to low-income families. But in the article that you would have seen in the conversation, we also did it up to families receiving up to $100,000 or earning $100,000, and actually made a difference to them. And there's a big debate out there about whether or not we should do universal cash benefits for families with young children versus more targeted.
Yeah.
And we'd have to test that more empirically. But there are places overseas that are looking at these kind of what we call universal cash transfers or universal benefits, and they might give some more to some and less to others. But there is something that says, hey, we know that families need money for their children. Giving everybody something's a really good thing, and we're really valuing children in what we're doing here, and we think and there's going to be a benefit to those children further down the track.
Yes, and if you're talking about the really young ones, let's say, between 2 and 5, there's a story almost every day about mental health. There's one today. The Salvos are saying they're seeing people who are just struggling with their mental health literally all of the time. So if you can take some of the pressure away financially, then that would have to be a benefit too.
You're exactly right. And all of the research shows that when you give families money, you improve parental mental health and well-being, which is a kind of like no kidding kind of moment, but and that frees up parents' time to be able to spend time with their children, be less stressed, and use that money to enable things around play, learning, etc. So I think there's lots of research that tells us people use this money in ways that make a difference for children, and it relieves stress. And when you relieve stress on parents, you relieve the mental health problems in kids. I mean, it doesn't annihilate things, but it absolutely makes a difference.
I'm just wondering, that $26,000, how would that equate to current government income support? As I said, rebates and subsidies and tax concessions, that sort of thing.
It's more generous than the current rebates, and the 26,000 was a number. You could argue it could be higher or lower. I guess depends when you scale these things out. It all becomes much higher and much less pleasant numbers. So I think we chose a number that made sense because we could reflect it back into COVID. I think it would be a separate question if we're going to do this as an actual trial in Australia, which I, of course, think we should. Yeah. What's that number? How does it make sense? How do you give enough money to make a difference, particularly for low-income families and those living in poverty, but still make some difference as you go higher up the income tiers? So I think that's a question to be answered, and I'd love it if we could answer it empirically in Australia.
Yeah. Stephen's got a question for you. Hi, Stephen.
Hi there. Look, I'm about to have another grandchild.
Good on you.
And
congratulations.
Thank you. The scene is that if you give someone $26,000, I don't understand. If you gave local council the $26,000 and they built a non-for-profit childcare centre, that would mean that the parent could go back to work and be another taxpayer. We used to have these non-profit daycare centres run by council, but it went, once again, they put it into private enterprise, and we know private enterprise is the most greediest cow we have. They just exploit it to the point of $700 a week to send your child to daycare. Put it back into the government-run situation, and you could build daycare centres all over the state.
Oh, Stephen, the low-income families we're talking about are no chance of affording $700 a week for daycare.
No,
not
they
remotely.
don't.
No, not remotely.
Right. Yeah. So you're right. So if you give them, if the budget was to give it to local council to build non-for-profit daycare centres, that low-income worker would see the benefit of having another child, because it's not going to cost them $700 a week to send it to daycare.
Yeah, okay. Yeah, thanks for the thought. I've got a text here too. How about the money invested in the children we already have? Well, yeah, that's true. I don't think we're talking about that, though, are we? Not in this instance.
Oh, you're asking, you're asking me?
Yes.
Sorry.
Sorry. Yes.
Yeah, no, this is a kind of modelling exercise. So if you had a child between, we're particularly interested in 0 to 2.
Yeah.
This is kind of benefit. You could talk about it being an early years boost, that sort of idea.
Yeah.
It's not a reward for having, people look at these things as a reward for having children, and that's kind of not a very helpful narrative, because people are having children. We kind of want them to have children in Australia because we need to generate enough, people working to generate our GDP, which is the previous conversation you were having.
Yes, indeed. And, Jason says all the extra money from COVID payments is the reason why we have problems with inflation now, because he thinks this is a bad idea. Look, how many, I suppose it's very hard to tell. I mean, what are we talking about? How many families would you be wanting to help with this one-off payment?
And it depends on whether you do it as a one-off. I mean, we modelled as a one-off because you only can, but you would probably give it as a fortnightly payment and not as a one-off lump sum if you're going to do it in reality. So if we were to trial this, it would be a kind of a fortnightly payment probably over the first 2 years at least of a child's life. And so it depends where you put the line in the sand. So if you look at poverty, for example, there are about 12% of children living in households already living in poverty.
That's right.
So, that's the sort of number you're kind of looking at. But I think a lot more thinking is required. Are you targeting, we targeted here families with incomes less than 100,000, and that's the top level of family tax benefit, I think it's B.
Yep.
So we're already sort of giving some of those families some money. The question is, we would give it on top of that because their hypothesis is it's not enough. So I think these are all really good questions. We don't have all of the answers.
No.
What we can say, though, is giving families money does contribute to close the equity gap, and we would suggest it's necessary but not sufficient and not the only thing you would do if closing the equity gap was your aim.
Okay. Have you broached government with this idea already?
So we've spoken to various parts of government about the idea of potentially trialling it, and I think that would be a fantastic thing to do in Australia.
Yeah.
Most of the trials have been done in the US, and that's a pretty different animal to Australia, and it'd be a fantastic thing to do. I mean, it's complex, isn't it?
Oh, yes.
Trying to do it as a trial. But I don't think we should shy away from things just because they're complex. And it's interesting hearing your listeners and the variety of views, and I'm always of the view that they're all very legitimate. Let's test it and see, and then we'll have some real evidence that says yay or nay.
Yeah.
So that's as a researcher, I'm obviously going to say that, but I do think it's important for the general Australian voter as well to be able to know the answers to these questions.
Yeah, and Brian, up in Maitland in the Hunter, could you please ask your guest what effect does the education level of the parents impact on the child's development?
So greatly is the bottom line to that.
Yeah.
So that's a kind of global phenomenon that we know there's a very strong relationship between particularly maternal education level and children's outcomes, education, health, actually all outcomes. And it's a kind of complex story as to how that kind of works. And it doesn't mean that if you don't have a high education, your kid's definitely going to do badly, but definitely in the research there's a very strong association. So one of the things, we always talk about is what are the other things we should be doing to ensure that as our population grows, we're thinking about ensuring they're staying engaged with school, ensuring they're employed, all of those sorts of things. And that starts with what you do and have for children in the first 5 years of life.
Oh, we're doing a story later in the afternoon about engaging with school and this whole, and it's terrible, really. It's almost an epidemic of kids just refusing to go to school. So my thought would be if you're starting very young, when they're 2 to 5 and there's money available to, get them interested in life, I suppose, and prepared for school, well, as you say, I mean, anything's worth at least considering.
Well, and I would argue that it's actually not 2 to 5, but 0 to 5. We've done a very nice program of what we call sustained nurse home visiting. So we had the standard nurses, family child health nurses in your state, go into people's homes regularly under a proper program, because that's all about exactly that, how to work with parents feeling like they can do things with their children, and exactly that, instilling that sort of idea of aspiration, ambition, being sensitive to your child, talking to your child, all those sorts of things. So I think it starts really early. I mean, I think we can have a much longer conversation about the kids not going to school, but from a longer term point of view, it's absolutely vital that we think about what happens from the antenatal period if we're going to make a difference for how kids go at school.
Yeah, and I guess it's a devil's advocate to comment. How could you ensure that this $26,000 is going to be spent by the parents in the right way?
Well, that's the typical sort of response. Aren't they going to spend it all on televisions, drugs and alcohol? And there's just no evidence to support that anywhere. Including from work done by a very now somewhat famous, but probably not that famous to everybody, a woman called Esther Duflo. She's a kind of Nobel Prize-winning economist, actually, who's really looked and tested all of this, and it's just not what happens. It's not how families work, and I think that's fantastic. And I think we have to be really careful of saying, well, if you give people money, they'll squander it, and in the meantime, we've got families bringing up children who are living in poverty, and that just can't be great for Australia, a country like Australia.
Well, general comment, all of the problems that we have in society now, and there are many of them, generally start, do they not, and correct me if I'm wrong, when someone is very young. If you can, provide money to educate, and you say 0 to 5, I agree with you. And, another school of thought used to be, and I think it was the case when my mum sent my little brother to preschool, it was more like a babysitter than anything else. But now it's very much the case that it's about early education, isn't it?
Well, it's about all the things that so clearly the most important people in children's lives are their parents or carers. And so really making sure that we're wrapping around families is just such an important thing, and enabling them to be the parents they really want to be is just so important. And then you're right, the services that we provide for those families, like high quality early childhood education and care, like the family and child health nurses, like our GPs, these are all fantastic parts of our infrastructure. But you're also right. If we can get it right in the first 5 to 8 years of life, and kids are actually kind of kicking goals by the time they're in grade 3, and I mean, I don't mean kicking goals, they're the top of the class, but they're engaged with school, they're enjoying things, they're on a whole different life trajectory to those kids that aren't. So I do think those early years make an enormous difference, and there should be a real impetus and a real energy, I think, in Australia to think about what we might do in those years. And in fact, nationally, we have an early years strategy for 0 to 5. So a real opportunity to do something really different in Australia and make a much more equitable future for Australian children.
As you say, pretty much anything's worth consideration if it's going to be positive. Thanks for your time.
Pleasure.